How did the World Health Organization come about and what reforms are planned? These questions are answered in the German EU Council Presidency series Looking Back, Looking Ahead on the occasion of the informal exchange between EU health ministers on October 2nd, 2020. The World Health Organization, the WHO, is one of the most important institutions in the world in the field of international health policy and the cross-border coordination of health issues. The aim of the organization is to improve and promote the health of all people. The WHO defines various medical standards, bundles scientifically sound health policy principles, and contributes to shaping the global research agenda in the medical field. When the United Nations, the UN, was founded in 1945, diplomats were already discussing the need for a special organization for health with international reach. The cholera epidemic of the mid-19th century and the Spanish flu of 1918 were still present in people's minds. These diseases and those that were still to come, and as we know now, those that are right now here, did not stop at borders and walls. The world had to react to them no less across borders. At the beginning of April 1948, the WHO was officially founded, replacing its predecessor, the Health Organization of the League of Nations. With reference to Article 25 of the Universal Declaration of Human Rights of the United Nations, the first statute of the WHO states, "It is one of the fundamental rights of every person, regardless of race, religion, political convictions, economic or social situation, to be one, if possible, to enjoy good health." At that time, 61 states signed the WHO Constitution. Today, the organization, based in Geneva, Switzerland, has 194 member states in 6 regions of the world, more than 7,000 employees at 150 locations, and 6 regional offices around the world. World health milestones are: to achieve its lofty and ambitious goal, WHO began coordinating various cross-border initiatives. Since 1948, for example, they have been the editor of the International Classification of Diseases, which not only helps to define the world, but also to compile global health trends and statistics using a common language. In 1969, WHO members introduced the International Health Regulations, which initially mainly dealt with cholera, plague, smallpox, and yellow fever. This set of rules set standards for world trade and international travel, such as the disinfection of airplanes and ships, the health documents that travelers must carry with them, and the procedures by which member states must notify the WHO if they develop these diseases. These rules have changed frequently since then, most recently in the noughties when it came to dealing with diseases such as Ebola or COVID-19. In the course of the 20th century, the WHO also established international programs to combat malaria, smallpox and tuberculosis, among others. Other diseases such as measles, cancer and HIV/AIDS should later add to the list of global priorities. The WHO also started monitoring areas such as cancer research, tobacco consumption, reproductive and sexual health, and diet and exercise. In 2008, they recognized climate change as a threat to human health. The organization is proud that, thanks to its involvement in decades of vaccination and awareness-raising campaigns, diseases such as polio and smallpox are virtually eradicated, as well as its contribution to the development of an Ebola vaccine and the improvement of basic medical care in less developed countries. But who runs the WHO? The WHO is an organization supported by the member states, the 3 pillars of which are the World Health Assembly, the Executive Council, and the Secretariat. The day-to-day business of WHO is managed by the Secretariat. According to the WHO statutes, the Director General is the first point of contact for all administrative and organizational matters. The organization's agenda and strategies are decided by the World Health Assembly, which takes place once a year in Geneva, where delegations from all member states discuss measures, appoint management staff, and approve the WHO budget. Every 5 years, the World Health Assembly elects a new WHO Director General. A single re-election is permitted. Public health researcher and former Ethiopian Minister of Health and Foreign Affairs, Tedros Adhanom Ghebreyesus, is currently in this position. Ghebreyesus is known for his work in malaria research and the improvements he has been able to make for the health system in his country. In addition, he is the first African in this office, which he will hold until 2022. As with the United Nations, member states contribute to the WHO biennial budget. These contributions are made up of the membership fees and voluntary payments determined for each country on the basis of gross domestic product. The budget, which amounts to approximately $5.8 billion for the period from 2020 to 2021, sets strategic priorities as members decide which funds will go to which area of WHO work. In 2018 and 2019, the United States, Germany and the United Kingdom, as well as non-profits such as the Bill and Melinda Gates Foundation, were among the largest contributors to the WHO budget. Less than 20% of WHO's funding comes from regular membership fees. Around 80% are voluntary contribution, which makes the WHO vulnerable. A global pandemic underscores the need for reform and strengthening of the WHO. The COVID-19 pandemic has once again shown how important a supranational coordinating body like this is when it comes to infectious diseases. Isolated national responses to international problems are doomed to fail, said German Federal Health Minister Jens Spahn at a WHO meeting in June in Geneva. However, the pandemic has also given rise to controversy regarding WHO because it has revealed the financial and political pressure the organization is in and always has been under. Several countries, including the US and Brazil, have threatened to leave. Others have criticized the WHO's handling of the pandemic and attributed alleged errors to political pressure. Many member states and observers broadly agree that the need for comprehensive reform of WHO, including in terms of capacity building, is becoming more urgent as the organization faces several health, financial and policy challenges. The European Union has an important role to play in drafting these reform proposals, aligning WHO with the 21st century and supporting the implementation of the reform, especially if major donors such as the US should actually withdraw. The proposed reforms should make WHO more efficient, sustainable and transparent, and should clearly delineate the areas of responsibility of the organization in interaction with other important actors in the field of global health. The role of WHO as an independent, lead coordinating agency would be strengthened in order to minimize the possibility of political pressure. In the event of new illnesses, relevant information needs to reach the organization more quickly in order to promote a better early warning and crisis response system. Better financial resources would also help. Of all health authorities, the WHO has the most extensive mandate and at the same time only limited financial possibilities. The member states are to provide around $957 million for the 2020-2021 budget. The current WHO budget corresponds to that of a larger regional clinic. More than 3/4 are earmarked and the funds are unpredictable. This allows hardly any planning security and only limited additional resources to deal with emergencies such as the current pandemic. The COVID-19 pandemic has once again shown that the international community's expectations of the WHO are far beyond their capabilities. Future reform must address the discrepancies between member states' expectations and their willingness to equip WHO with what it needs to find ways to balance expectations and capacities. More independence and the strengthening of their skills should be part of this. Many of the EU's achievements and regulations can only be understood by looking at their long history. That includes the EU inside the WHO. That's why I did that today. They are taking the informal councils and other events during the German EU Council Presidency as an opportunity to take a look back at the emergence of different policy areas in the European Union or places the European Union has to play an important role in. At the same time, they ask, how can the EU develop further in this area? And if you now want to know more about European or global politics, YouTube has chosen another of my videos right here for you on the end screen, right next to your chance to subscribe to my channel. I'll see you in my next video. Click and enjoy. Viel Spaß!